Good afternoon, everyone. I hope everyone is enjoying this second day of fall, and thank you for joining us today for the 2-year celebration of 211. Before we dive into the celebration, I'd like to take a moment for you to imagine a world where access to emergency housing, mental health counseling, transportation, food pantries, crisis intervention, and employment was not readily available. Imagine a world in which a person in need of essential services will become disillusioned, disenchanted, and discouraged, attempting to navigate their way through an antiquated referral system with no interagency collaboration, and oftentimes having to travel from location to location or make multiple phone calls and possibly still not receive the assistance they so desperately need. However, on September 24th, 2019, there emerged the dawn of a new day with the kickoff of the United Way 211 Lake County Hotline. Now, there is an organized, efficient, professional, and multi-layered service that has made access to essential services that I mentioned above readily available by simply pressing the 3 numbers of 211. Through the first 6 months of 211's existence, a good number of individuals and families were assisted. However, 211 was still somewhat of a secret. Then on March of 2020, the world stopped. A pandemic which had a profound impact on each of us. A pandemic which had no boundary or discrimination based on race, socioeconomic, personal, professional status, or level of education. A pandemic that facilitated a sharp increase of drug and alcohol abuse, domestic violence, depression, and many other mental and emotional health challenges displayed that everyone in Lake County, regardless of the zip code you lived in, needed and benefited from 211. My name is Mark Jones, and I have the esteemed privilege of being your host for today's 211 2-year celebration event. I celebrate with you all today, and I'm celebrating all the connections that 211 has made for all of our neighbors in Lake County. Connections to food and domestic violence assistance, and help paying rent and utility bills, healthcare answers, mental health resources, the whole gambit. And I'm sure you all watching are celebrating with us as well. Now I invite you to sit back, relax, enjoy hearing some stories about the tremendous impact of 211. Here's some data-driven reports on the huge impact 211 has had throughout Lake County. We invite you to sit back and enjoy. Now we will post our agenda. You will hear from a great group of people who have been making 211 happen. We'll learn about the 2-year results, discuss them with a panel of Lake County Human Services experts, including the director of the 211 Contact Center, and who will share a real-life story of 211 and how it's impacted a real family in real life. And of course, we will talk about the future. Now let's get started with the core membership team from the United Way of Lake County. The wonderful and fantastic Christy Long. Christy, take it away.
Thank you, Mark. It is wonderful to be here with all of you today. We are so proud to celebrate the 2nd anniversary of 211 for Lake County and all the connections we've made for our local families and neighbors in need. We launched 211 on September 24th, 2019, just 6 months before the pandemic. And goodness knows it could not have come at a better time. Whether it's been providing reliable information about the pandemic, testing, or vaccination sites, or helping people stay in their homes, put food on the table, and pay bills, 211 has truly been a lifeline for tens of thousands of people across the county who have found themselves in crisis, including many who never thought they might need help. In fact, last month, we reached a major milestone of 100,000 contacts to 211, which means 100,000 connections to critical services and help since we launched just 2 years ago. The community has clearly embraced 211 as Lake County's one-stop shop for help, and awareness continues to grow. And it should be of no surprise that our 211 team keeps rising to the occasion. They are the invisible first responders that no one sees, yet are always there to answer the call. This past year, our 211 contact center has responded not only to an increase in call volume, but also longer call times. Many callers are feeling anxious, fearful, exhausted, with more complex situations and needs than ever before. They're looking for answers and someone to talk to. And our bigger, better, and more well-known 211 has done a lot, including promoting the 2020 census by directing people to contact 211 with questions, made it easier for people to connect with rental assistance by creating a centralized screening process through 211, partnered with the Alliance of Health and Human Services to refer food insecure families to free food delivery services, partnered with EverThrive to ensure families were tapped into a network of resources to support them before, during, and after pregnancy, teamed up with the Lake County Health Department to promote wellness resources, promotion, education, and referrals, secured an amazing advertising campaign with billboards throughout Lake County and on Pace Bus advertising, and celebrated 211 Day on February 11th with a social media campaign and a proclamation by the Lake County Board. I am so proud of the work our 211 team did, and of course the work of United Way of Lake County did to continue to serve in the most difficult of times. It's exciting to hear how far-reaching and transformative 211 has already been, and part of that success comes from the generous funding 211 received from many, many caring partners. From our largest contributors, such as Lake County government and the city of Waukegan, to local townships and companies delivering on their corporate responsibility promises, to our small businesses and community service groups, right along with many philanthropic individual donors. It takes everyone's time, talent, and treasure to keep 211 running smoothly, and perhaps as importantly, to get the word out. We can't thank our funders and our partners enough. You should know your generosity has already made such a big difference in so many lives. And you're going to hear some of those examples in just a few minutes. Meanwhile, I ask you to continue supporting 211, donating $211 and become a member of the 211 Club, or donate at a sponsorship level to be recognized again and all throughout 2022. We are so grateful for your support and so glad you're here to celebrate with us this afternoon. Irene, as our overall 211 Advisory Council leader, we're looking forward to hearing from you next.
Thanks so much, Christy. This has been another incredible year for 211 and for making a difference in the lives of our neighbors all across Lake County. 211 is providing help for so many people struggling to make ends meet, help navigating support services, and help accessing essential benefits to build a better life. When we formed our very first advisory council and started brainstorming about what 211 could mean, we knew we wanted a program that would serve everyone in Lake County, regardless of the language they speak or where they live, whenever they found themselves in need. After all, many of us need some kind of assistance at some point in our lives. As you'll see today, 211 has had contacts from every municipality in the county. Every zip code is represented, and an amazing variety of demographics. While COVID has focused the request into a few key categories, which you'll see in a moment, still help in every area of human services was requested again this year. The team has also kept the 211 contact center's comprehensive database current by responding to constantly changing resources and services. More than 1,100 updates were completed this year alone, not counting the day-to-day COVID updates. Together, we continue to raise community awareness of 211 and the array of services available. We're examining the barriers to seeking help so we can more effectively motivate those in need to reach out and ask for guidance. including those who have been disproportionately affected by the physical, emotional, and financial impact of COVID. Overall, we're using data to focus on reaching those most in need of support and relief who might not realize 211 exists and would benefit from referrals. We're delighted to have had another strong year of reaching so many people. Now, here are Deanna and Julie with a deep dive into the data.
Thanks, Irene. My name is Julie Gordon, and it's Deanna and my pleasure to present to you data from United Way 211's first full fiscal year of operation. We're going to be sharing with you information about the contacts to 211, their demographics, information on the needs that they've presented, and how 211 is responding. Let's go to the first slide of data. For the fiscal year ending June 30th, 2021, for that 12-month period, we had 10,780 calls or texts coming into our service center. That breaks down to about 82% by phone and 18% via two-way text back and forth with the service specialist. During the same time period, we had 39,570 different connections to our 211lakecounty.org website. This totals to over 50,000 connections with 211 in Lake County for fiscal 21. Next slide. As we look at those 10,780 calls or texts coming in by month, you could see that it's a lot. We get about 900 calls per month, with the period from November through January seeing kind of the highest relative number, which was somewhat driven by 211's assistance with the rental assistance screening that we did. The number of calls we got this year far outpaced what we saw last year and in the initial months of 211 when we launched, when the number was closer to 400 a month. We started asking callers the question, are your needs caused by COVID-19 in November 2020? From that period forward, about 62% of our contacts responded yes, that their needs were driven by a COVID-related reason, maybe health or economic or both. On the next slide, we'll see website sessions. This is again through the 211lakecounty.org website, where it provides lots of useful information on community resources throughout Lake County and can be accessed by anyone. This averages about 3,300 contacts a month, again, totaling 39,570 for the year. One of the areas we're going to explore in the next year is to better understand who's accessing our website and what they're searching for. Let's go on to the next slide. All of the next slides refer to demographic or information collected on those individuals calling or texting into our center. While the majority of contacts to 211 come to us during business hours, 27% of contacts are made outside of normal business hours, either on the weekend or during the week, but after 5 p.m. or before 8 a.m. In the upper right-hand corner, you could see some individual call averages. And as was mentioned before, we have very long wait times and abandonment rates higher than we'd like to see. This has been driven by the unfortunate impact and challenges that have been experienced due to the pandemic, mostly due to remote work requirements by our service center staff, as well as staffing shortages. It's also impacted by the fact that the talk time, once the caller does get through, is much longer than what 211 would normally receive in a non-pandemic environment. Our call center has been working very hard and very creatively to improve responsiveness, and I'm very pleased to say that we've seen nice improvement over the past several months. On the next slide, you could see how people actually hear about 211. So that's a question that the service specialist asks to first-time callers. How did you hear about 211? 25% are hearing about 211 through an agency. So thank you to all those agencies that are on this call. Your referrals mean a lot to our community. We also continue to be pleased with the high percentage of referrals we're getting from friends and families. This speaks to a high overall satisfaction and sense of value with 211 amongst our community. The third category, other, the biggest contributor to this is actually rental assistance advertising, which has become a new way that people are finding out about 211, which is terrific. But you could see it's a broad array of ways that individuals do find out about 211, and that's a good thing. Let's go on to the next slide. Who's calling 211? On this slide, you could see the top 10 communities of individuals calling into 211. But as what was mentioned before, we're getting contacts from every zip code and area of Lake County. And while most calls and texts are from Waukegan, as a percentage of population, we actually see similar percentages across other cities, such as Zion and Antioch. So 211 is far-reaching and reaching every corner of our county. On the next slide, we see an age and gender breakdown of those individuals who are contacting 211. Most of our contacts, 72%, are in the age 18 to 54 group, with 27% age 55 and older, and only 1% under age 18. We do have plans for additional outreach to schools and personnel in the spring, with the hopes that we can connect to more young individuals who see 211 as an avenue for help. 69% of callers are female, and that's been pretty consistent since launch. On the next slide, we see a breakdown of race and ethnicity. We've combined that into one metric. You can see that almost 31% of callers into 211 are Hispanic or Latino. Almost 36% are white. 30% are Black. About 3% are Asian, Native American, or Pacific Islander, and 0.5% are American Indian, Alaska Native. Deanna's actually going to drill down into Hispanic and Black callers more to understand some of the demographics of those groups. On the next slide, one of the questions that we ask is, what is your primary source of income? 33% of contacts are employed, but I think this speaks to the needs of those that are working hard, but still struggling to survive and really impacted by COVID. We also are seeing 24% reporting no income. These might be immigrants, seniors, those not working, who don't have access to benefits, either because they haven't reached out, perhaps because of fear, or they just don't know how to. And our service center will actually help them apply for some of the public assistance or unemployment benefits that they might need help with. So that's some of the demographics around the callers. I'm going to turn this over to Deanna, who's going to cover some of the needs that they're requesting as they call in. Deanna?
Thank you so much, Julie. So let's talk about needs presented to 211. In fiscal year 21, we saw 18,423 needs from all of our calls and texts to 211. On our next slide, we'll see the trend of calls and texts and needs. So this shows our contacts versus the needs. The top orange line is showing the 18,423 needs across all of the months. And these, again, were requested over the entire fiscal year. The bottom blue line shows the 10,780 calls and texts that we received. Some individuals do contact us strictly for information. This could be information on COVID-19 vaccine availability, information on rental assistance programs, and many more things. These often don't record a need or a referral in our database, but again, are getting valuable information from our specialists on particular issues that they're interested in. However, most individuals do have a need that ends with a referral with some having multiple needs. We've seen as many as 10 or more needs from a single 211 contact. Navigators are experts at needs assessment. They listen, they ask probing questions to understand root causes of the needs presented and questions to understand other needs that might be present as well. This leads to more needs and referrals for individuals, and we're right now averaging at 1.7 needs for each contact. And our next slide, you can see needs by category. While navigators collect specific needs for each contact, our team typically groups needs into 13 categories that's based on a national model. Other categories captures miscellaneous needs like general information and referral, donations, volunteering, animal control, and more. The largest category of need by far is housing and shelter, as you can see by this graph. This is followed by utilities. And we have seen really consistently that housing, utilities, and food are in our top 3 needs since launch. Next slide, please.
So let's look at needs by outcome. 211's purpose is to reduce the time and frustration for individuals to find resources and get a referral to an appropriate resource. We do this again by providing referrals when available for an individual's need. This chart shows the numbers of needs with a referral made. That's when a navigator has an available resource to meet that individual's needs in blue. In orange, you're seeing where needs were presented and referrals were not unfortunately available. The percent of needs receiving a referral is continuing to increase each year, with 85.5% in fiscal year 21 being referral made compared to just 73% in our prior report. Our biggest category, housing and shelter, had the highest number of needs not met, but of needs met, and utilities and food had the highest percentage of needs met, with 95% of utilities needs receiving referrals and 93% of food needs receiving referrals. So as noted, the percentage of needs not receiving a referral is very low. It's only 14.5%. The majority of these are being seen as a result of a service not existing or a client that was not eligible. The largest number of needs with no referral are in housing and shelter, with 956 needs, or 12% of overall need category that didn't receive a referral. However, when we look at percentage of a category that's not receiving referrals, transportation comes up with 44% of the 144 needs presented to 211 not receiving a referral. These are primarily in automotive repair, various transportation services, and gas money. We'll talk a little bit more about needs with no referrals in just a minute. So let's go to the next slide. So prior to this, we've been predominantly talking about categories of needs, but I wanted to show you a breakout of some of those individual top needs that we're seeing. So as you can recall, the top 3 categories of needs were housing and shelter, utility, and food. Looking at housing and shelter, the top 5 needs have remained consistent from last year. It's really important for me to note to everyone that rent payment assistance has been the #1 need presented to 211 each and every single month since we launched September 24th of 2019. In fiscal year 21, rent payment assistance alone represented 23% of overall needs to 211. This past year, we have helped support both the COVID Housing Relief Program and the Federal Emergency Rental Assistance Program through the Lake County government. This resulted in 1,905 rental assistance assessments that were conducted through 211, where we were able to provide referrals to providers, getting individuals in that path to receiving rental assistance and getting their needs met. Now I want to take a look at some of those individual needs where referrals were not met on the next slide. So as we talked about a little bit earlier, a majority of the needs with no referrals are in that housing and shelter area. The #1 need where referrals are not being made is within rental payment assistance. Again, a very small number of overall needs presented here, but still showing up in that top 10. And we're seeing that a majority of individuals are not eligible for the rental payment assistance programs that are available when they're contacting us. We always encourage people to call back as rental payment assistance programs change frequently and there may be something that comes up at a later time that they're able to meet. The second area we're seeing is homeless shelter. Again, we're seeing a lot of eligibility issues here. Looking through our cases, we're seeing lots of times where individuals are saying they've tried other places, they haven't been eligible for programs, and there's simply no more services that are available for them based on their situation. The third highest area is homeless motel vouchers. We have a lot of people that contact us that would prefer to stay in a motel versus a shelter type of provider. However, this type of service is only accessible through a homeless service provider and after an assessment is done on an individual's risk factors. Therefore, all of these requests to 211 would be noted as service does not exist. It's not a referral that we can provide through our system. The last thing I want to note here is that a number of the needs that are showing up in our top 10 are housing search related. This really speaks to the challenges that people face in finding affordable housing. Next slide.
Deanna, before you go on, we are getting one question on needs, and it is what percentage of needs are recurring? So I assume that means by an individual needing to call over and over for a specific need. But the specific question is, what percentage of these needs are recurring?
So we don't collect information on reoccurring needs. We do collect information on second-time callers. I don't have that data in front of me, but that's something I would happily provide and follow up to everyone.
Okay, that's great. We have one more question. What are some of the reasons you would not be eligible for rental assistance?
So overall, when we're looking at need and referral outcomes, we're typically just collecting if a client is not eligible, but I can tell you anecdotally that we do find, particularly with CHIRP and FARA, that someone may not have a COVID-related reason for being eligible for rent payment assistance. There may not be a program accessible to them at the time that they contact us in their area. So they may be geographically restricted from rent payment assistance. And then sometimes individuals are earning too much income to qualify for assistance. So that's just an anecdotal examples of things that people may cause them to be ineligible. But again, the vast majority of people that are calling for rent payment assistance are receiving a referral to a service provider for that need. It's a very small number of individuals.
Great, thank you.
Absolutely, thank you, Julie. So I want to take a minute to talk about communities of color. AIRS, which is a national standards-based organization for 211, states that 211 contact statistics should roughly reflect the census breakdown of communities. When we did an analysis of our census statistics compared to our overall contact statistics, we saw that we have a higher than expected Latino contact rate. We believe that's reflective of the engagement that we've done in that community, as well as the Spanish marketing that we've done throughout the county. We also see that we have significantly higher rates of Black contacts than would be expected. This year, we'll be hosting some listening sessions throughout this community to learn more about that contact rate, the experience, and things that we can do to make sure we're really effectively meeting the needs of that community. Analysis also showed that we have significantly lower rates in the AAPI community. We don't have a lot of data here right now because of the low contact rates, but one thing we are going to be pursuing, again, is listening sessions within these communities to see if there's barriers that we can address to contacting 211. We hope to provide some more data on that community, particularly in our next year. Today, I'm going to highlight a few statistics from the Latino community and then the Black community, as these, again, are some of our more high contacting communities. So within the Latino community, we do see that this is the highest percentage of communities of color that are contacting us. Typically, these individuals are noting at a higher rate that their needs are related to COVID-19. And we are also seeing more needs in utilities, food, and mental health. However, most of their needs, when we look at count purely, are in housing and shelter, which is reflective of the overall 211 population. One other thing that we see is that we do have more clients from Round Lake and Mundelein that contact us and identify their race or ethnicity as Latino or Hispanic. So let's take a look at the Black community next. So this is the second highest community of color that's connecting with us. They are more likely to hear about 211 from an agency. So thank you again to our agency partners for all that you're doing to help refer individuals. We are seeing that this community has greater needs in housing and shelter. This is more significant than other groups, but we are seeing that they have less needs in other categories. So again, bigger needs in housing and shelter, less needs in other categories. We'll be continuing to review trends based on community group, demographics, and many other factors. And again, hope to have more data to share with you, particularly about the AAPI community in the future. So let's talk about follow-ups. Each year, we hope to conduct a follow-up call or text with about 3% of our contacts within 1 to 7 days of their initial contact to 211. This is used to determine their satisfaction, if they received help, and if there's anything else we can do to help them. This year, we were able to connect with 6% or 659 individuals connecting with 211. So we're very, very pleased with those results. We're also pleased to report that satisfaction with 211 continues to grow. We are showing that 99% of individuals conducting a follow-up believe our staff are polite and professional, which is always wonderful to see. That 91% had their expectations of 211 met. This is up from 85% last year. 94% are recommending 211 to friends and family, up from 2% last year. And again, we saw within the rates of who or how are people hearing about 211, that this was the second biggest category. So very reflective in both areas. And last, that many people are learning about a new resource from 211. And this shows the power of 211 in opening up opportunities for people to receive help and get that help that they need. So on our next slide, we'll talk about how people access services. So again, keep in mind, this is 1 to 7 days after an initial contact to 211. And when we follow up with individuals, we're finding that 87% are reporting that they received the information they needed to connect with an appropriate service provider. Individuals are also reporting that they are following up with the referrals. So 67% of people have already followed up and have reached out to that service provider that 211 gave them information on within 1 to 7 days. So that's really fantastic. Even more so is that 51% of those individuals are in the service pipeline. So they are already receiving service, or they are on the wait list or waiting to complete an application. So people are on the path to getting the help they need from 211. We're really pleased with these results, and I'm going to turn it back over to Julie to just wrap us up here with data.
Thanks, Deanna. As we wrap up this section of today's event, we'd just like to emphasize that United Way of Lake County is committed to using data to inform decision-making and improvements regarding its 211 program and delivery. It's our hope that the information we analyze and share with all of you provides helpful and actionable insights into our 211 services, as well as health and human service needs across Lake County. So we hope you've enjoyed it. There have been a few other questions that have come into the chat. We will get back to you if we haven't answered the question during our discussion. But with that, I'm going to turn it back to Mark. Thank you very much.
Thank you very much, Deanna and Julie. We do appreciate that the data that you have provided. That was very meticulous and extensive data indicating to us the services that are most in demand and the demographic breakdown of who is requiring those services. This obviously allows 211 to tailor programs and different resources to those specific communities and make data-driven decisions on how things are done. So we thank you so much for that report. It was very detailed and very good. Now, at this time, ladies and gentlemen, I'd like to invite you to join us as we go into our panel discussion. We are very, very excited this afternoon to have with us a dynamic panel of human services experts. We have a nice array of people. We have people representing the government, the Lake County Health, the Lake County government, city government, some of our social service organizations, I would like to dive right into our panel discussion at this time. So please allow me to introduce our panel. We have first with us Ms. Kelly Brown, who is the Community Information Officer for Interface Children and Family Services. We also have with us at this time Mayor Billy McKinney, Mayor of Zion, Illinois since 2019, former NBA player, front office executive, moved back to Zion, and is now the Mayor of Zion, Illinois. Mayor McKinney's with us. We also have with us at this time Mrs. Brenda O'Connell. Brenda O'Connell is the Community Development Director of Lake County Government. If any of you have done anything with CDBG, I guarantee you went through Brenda. So it's great to have Brenda on the panel with us today. Along with Brenda, we have Mrs. Mary Lockhart White. Ms. Mary Lockhart White is the Executive Director of Community Action Partnership of Lake County, also known as CAP. Ms. Lockhart White has been a community pillar and staple for a very long time. Excited to have Ms. Lockhart White with us as well. And finally, we were joined by Anna Yankelev. Oh my goodness, I practiced that too. Anna Yankelev is with us from the Lake County Health Department. Anna is a strategic planning and partnerships manager with the Lake County Health Department and Community Health Center. So everyone, please join me in a virtual warm welcome for our panelists. So panelists, will you please open your videos, unmute your microphones, and let's dive into this discussion at this time. First of all, how's everyone doing today?
Doing well, Mark.
Fantastic. Awesome. Okay, thank you. Sorry about that, Anna. I can't believe I did that.
I forgive you.
All right, we'll get right into it. So I have my initial question is for all of you, and I'd ask all of you to respond basically roughly 1 minute to this initial question that goes to all of the panelists. What is one really positive outcome related to 211 that each of you have experienced or observed in your specific field of expertise this year? Give us one really positive outcome that you have personally seen 211 have. I will start with you, Anna.
Sure. So I think one really positive outcome that has come out of the last year is helping our community understand that health isn't isolated to just healthcare or mental health services, that what makes us healthy is our ability to access all sorts of different resources, whether that's healthy and nutritious food, safe and affordable housing, a job that pays a living wage and offers benefits. All these other factors are part of that. And so 211 has been a wonderful hub to help connect all of our community members to the different resources that help people lead healthy lives and have healthier outcomes in their regular day-to-day checkups and things like that. So we are really grateful for that partnership to elevate that understanding that health is all of that together.
That's right. Yeah, excellent. Thank you, Anna. Appreciate that. Kelly?
One positive outcome from the last year has been providing better access to rent payment assistance that has become a critical need due to the COVID-19 pandemic, and being able to help people to navigate the application process and understand where the benefits are available for them and how they can qualify for that at a time when it's needed, such a high need for the county.
Absolutely. Rental assistance definitely is paramount right now. And the county, it's actually a perfect segue. Your answer, Kelly, is a perfect segue to Brenda, who's done an awesome job from the community development level of Lake County of disseminating those FARA and CHIRP dollars to different agencies. So Brenda, well, please go ahead and give us one outcome that you can speak on.
Sure. I think along with so many other people on this call, we have seen a real positive outcome around that strategic challenge of how do we get the word out in an environment where everything is uncertain and complex and changing. As we're looking back on a year's worth of data, we're talking about 3 different iterations of rental assistance programs that we've gone through because of different funding sources and different needs and different requirements. And just being able to say to people, have questions, call 211. Need help, call 211. Text 211. The most recent information will always be available there. That's been a huge, huge asset, especially when we're talking about new populations accessing assistance, people falling into crisis that maybe are not familiar with our system. So that has been a incredible resource in the last year.
Absolutely, Brendan. I do have to say this note, as you know, you all did allocate money to the Waukegan Township. Since April, we have allocated over $650,000 in rental assistance from April to now. So it's been a tremendous need in the community that I can also personally speak on as well. Then it brings me to the wonderful Miss Mary Lockhart White. Mrs. White, how are you today?
I'm wonderful, Mark. Thank you very much. And
Yes, ma'am. What is one really positive outcome, I'm sure out of many, that you can tell us about?
well, first of all, I'd like to thank 211 as well as United Way and all of the partners for everything that they have done thus far and will continue to do. I think from our perspective, we think that the most critical piece has been able to identify new clients. Everyone knows what community action does. We've been here for 50 years, but those that have not used our program before would have a difficult time finding out and navigating around how to reach us. So 211 has been very instrumental in identifying new clients. Thanks to the county, as you indicated, we did get dollars and still get dollars from the county to help with rental assistance. And we're to the tune of about $2 million at close to about $1.5 million, almost to 2 million that we've gotten out on the street for them. So I think it's critical that we continue to support 211. Very good job, and we look to continue to partner the remainder of the year. Thank you, Mark.
Yes, ma'am. And last but not least, unmute yourself, Mayor McKinney. Mayor McKinney, what is one really positive outcome related to 211 that you can tell us that you've personally experienced or observed from the mayor's office?
I can say this, being able to provide our residents with the resources while we provide services, usually street cleaning and police and fire, but being able to direct the citizens that call me quite a bit just about the 211 program and being able to provide them with the resources that they need. And I think one of the most important ones, when we talk about rent payment assistance, has been the mental health issue over the last 2 years with the pandemic shutting down. Not only are kids, as they're going back to school, they need to be re-socialized, and so do some of the adults. And one of the most amazing stories I heard from one of our police officers, they had stopped a gentleman that was in a mental health crisis. And our police officers carried the 211 information around with them in their cars. They were able to talk to this gentleman for a while, get him calmed down, and enable him to be able to call 211 to give him some help. It's those personal things that we have to do as a community now to take that extra step to maybe do things that we haven't typically done in the past. So this is a tremendous program. We thank United Way and 211 and the county and the state for providing this program that's so useful for so many of us during this very difficult time.
Mayor McKinney, I actually want to just follow. I think you said something pretty profound right there. Essentially what you said was someone called 911 and 911 called 211. And I think that is actually a pretty profound statement. They call the police, and we oftentimes talk about our law enforcement not be able to de-escalate people who may be having a mental crisis.
Yes.
So I think it's very telling that members of the Zion Police Department called 211 and they saw someone in mental distress. So instead of maybe excessive force, they found a way to de-escalate with the use of 211. I think that's a tremendous story.
Well, Mark,
really.
not only that, we make sure that during city council meetings that we talk about this. We push this out to the public on our Facebook posts and our city pages. Our police do it on their page, our public works, all of our departments do it. And we make that a focus as we go through this time, as we have department head meetings as well.
Okay, thank you. Thank you very much for that, Mayor. I have another question. Brenda, this question's for you. Brenda, since its launch, 211 has consistently shown housing and shelter as the most significant need across Lake County. The county has responded by adding programs and resources, including rent and utility assistance. Can you share more about those resources? What are some ways 211 is helping to connect people with those resources and making the process easier? Brenda?
Yeah, great question. We've talked about that. I just wanted to say one more thing about housing affordability, which is we know that this is a need. It's an ongoing need. In Lake County, a worker needs to make $24.98 an hour to afford a typical 2-bedroom apartment, and that's out of reach for many workers. And for our neighbors on a fixed income, such as seniors or people with disabilities, like that is really a big stretch. And this impact, we know, is well documented that it's disproportionately felt by people of color. And I think that in the past year, we've seen how the COVID-19 pandemic has disproportionately impacted different communities. And that's why it's been such an incredible year of being able to just increase the investment around rental assistance. So early in the pandemic, the Lake County Board allocated some of the local dollars for a program that we called CHIRP locally, the COVID Housing Relief Program. And that allowed us to provide a lot of support to people and to get going with an infrastructure that we then used to scale up over 100 times to get even more assistance out in the program that we're now running called FARA. So we've seen just unprecedented investment in low income renters, and this really assists renters. It assists landlords. It assists the local economy. This is a public health strategy because people who are stably housed have less COVID risk. They have a place to shelter. And it's also an economic recovery strategy. We know when people who are housed, their children do better in school, their mental health is better, their physical health is better. And so I think this has been such an incredible time. And 211 has been an important resource, not just a marketing strategy. 211 and the call center, Kelly's team has stepped up and they are providing information on specific eligibility criteria. They in CHIRP were screening applications and submitting pre-screened applications to our partners. So we've really been able to leverage the capacity of the call center to try and make the process easier for people. We took what we learned in CHIRP, we made it even better in FARA, and we're really proud of the work. Lake County has spent over $9 million in this most recent FARA program in direct assistance to landlords, utility companies, to help support low-income renters. We've served over 1,300 households, and many, as you referenced, many folks on this call are helpers in that. We do this through our 15 community partners, including Waukegan Township and CAP. So this has been a real team effort, and 211 has been able to be that glue in the middle to help make sure that people don't fall through the cracks of this uncertain time.
So Brenda, a couple follow-up questions for you. How long were the current rounds of federal emergency rental assistance dollars be made available to the community? What is the longevity of those funds will be available to people that need them?
Yeah. So right now we are spending our first allocation of emergency rental assistance from the Treasury. And it really has a lot to do with Congress and what they put in their act. So that was just over 20 million. Then we received another 16 million. So this most recent pot of money is $36 million. That first 20 million has to be spent by September 30th of 2022. And then the ERA $2, we do have a little bit longer. We have, I think, until 2024 to wind that program down. But
okay,
we're not slowing down. We're getting as much assistance out as fast as we can, trying to respond to the need.
Good. Yeah, and I was going to say, I believe the eviction moratorium, does it end this month? I believe it's the 30th or it's approaching rapidly. So if people have a need for those funds, I'm assuming the recommendation would be to apply now. Very briefly, where will someone go to access the links to receive these funds?
Yeah, I mean, a couple things. The eviction moratoriums have changed very much over the last year and a half. Evictions are being filed right now. The eviction moratorium currently means people aren't being put out on the street, but evictions are being filed. The process is starting for many people. We have a representative in eviction court making sure that they're connecting to the service, but that's far too late. We want people to apply now. If they're struggling with rent, you're a low-income renter, apply now, long before you're in court. Second question was,
Where? Go to lakecountyil.gov. Where do they go? Very quick.
link in the chat that's to our application, but also call 211, text 211. They'll help navigate you to a partner. We have a broad array of partners that are assisting us. You can access some information on the web, but if you want to talk to a human being, call 211.
That was the answer I was looking for. Thank you, Brenda. Call 211. Call 211. All right, Anna, I have a question for you. The COVID-19 pandemic has amplified the disparities of communities of color and low-income people in Lake County. How has 211 made an impact on health-related needs and helped improve access to care? What are some of the ways that Lake County Health Department has partnered with 211 to drive improved health outcomes?
A great question, and there are many different ways that we've partnered together to help improve health outcomes. And so when we think about more traditional health outcomes, being able to go to the doctor, get the care you need, whether that's clinical, dental, mental health care, 211 has made over 600 referrals in the last year to the Lake County Health Department for our various programs, from our community health centers to tobacco cessation to our addiction treatment programs. So this link really helps our community members access and utilize the health services that they need. But back to what you were saying about how some of our community members have been impacted more seriously by the pandemic than others, we've really worked hard with partners like 211 to make sure that health-related needs, so beyond clinical and behavioral health care, to make sure that those needs are met. And one of the biggest needs that emerged as a result of the pandemic was the need for families in quarantine or isolation to receive direct food support that enabled them to stay safely in their homes during that period. Many families we know can't afford to take off work for 2 weeks and miss that paycheck to provide food for their families. So a group of community organizations, health and human services providers, local foundations, food vendors, partners like Miss Mary Lockhart White with CAP as well, work together to launch the Lake County Community Action to Combat Hunger, or CATCH program, to fill this unmet need. 211 was one of our biggest referral partners, helping to identify and help the families in need of support. And together, the CATCH program delivered 2 weeks of free meals to over 1,000 families in the last year to help families stay safely at home during their quarantine and isolation periods without having to worry about getting food on the table. Another way that we've partnered with 211 is through our community case management programs, which complements the resources that 211 provides by helping community members who need a little extra support and handholding in navigating and utilizing the resources that they need, providing follow-up to make sure that they were able to access them, and really helping to close the loop with knowing what they need and being able to use them. And our case managers use 211 regularly to identify the right resources for their clients. So that's been a really fabulous partnership for us as well. And finally, 211 has been an integral partner in helping to get people vaccinated. In February, 211 and the health department partnered together to increase the distribution of messaging regarding AllVax to 211 contacts. And 211 was able to utilize their texting platform to send over 20,000 individuals educational messages about COVID-19 vaccines and the AllVax platform that we created together. And 211 also began asking their callers about their AllVax registration status, and were able to make over 250 referrals to the health department and to some of our other community health ambassador partners to help folks get registered and access a vaccine. So navigating this past year has been uniquely challenging for so many of our community members, and has really reinforced this understanding that none of us can do this work alone. We need each other, and 211 helps us have each other's backs. So we are just so grateful for 211 to serve as our resource hub, to keep our organizations and our community members connected to one another. And we are very much looking forward to many more years of continued collaboration.
Thank you so much for your answer, Anna. And I think it's remarkable the multifaceted benefits of 211. I mean, from vaccinations to sending meals to 2,000 families simply by calling 211. The value of that can't be understated enough. That is amazing. Thank you for all you do with the Lake County Health Department and your collaboration with 211. Kelly, coming to you. Okay, Kelly, as the director of 211, the 211 Contact Center, how have you and your team adapted to the many changing and growing needs of the pandemic? We are heading into the second year of the pandemic now. A big shout out for all the work that you and your team have continued to do during these extraordinary times. I'm sure it's been very trying and taxing. Thank you for your resiliency and continuing to be there for people in need. How have you been able to keep delivering the magic of 211 in these very uncertain times? And what are you seeing in terms of needs this year versus last year as people calling 211? And lastly, can you share a recent story of how 211 has been a lifeline for a local family in need? Again, numbers tell a story, but nothing illustrates the effectiveness of an initiative like 211 better than the human element of people actually impacted and benefiting from this program. Kelly?
Thank you. The COVID-19 pandemic brought a lot of sudden changes to our contact center. Before the pandemic, if you had asked me if we would ever be a completely remote contact center, I would have said no, for sure. But when we got the notice from our public health department that there would be a stay-at-home order in place, we heard that at about 3 p.m. on a Friday. And over the weekend, my 211 admin team worked to get everyone remote by that next Monday. And our staff have been working remote ever since, over a year and a half at this point. And there are challenges that come with working remote. Some of them obvious, we had been in a shared desk arrangement before, having to get equipment for every single person to take home, having difficult conversations with employees about their living situation, where they didn't have an appropriate place to work at home or a private place to work at home, and having to work through those situations with staff. And now that we have been doing it for so long, a major challenge is just keeping that connection with staff, keeping that personal connection. Conversations that you have over Zoom or email or chat just don't hit the same. Sometimes things that we are talking to staff about, if there's quality issues or a change in their schedule, just being in person helps to get through those conversations. So we're trying to navigate through that now, keeping some kind of a personal connection to the staff that work for us and are doing such difficult work. Also, we have had to double staffing. The size of our team has increased by an unbelievable amount. And I would say the majority of our staff, I have never met in person. I've never seen them in person. I've never worked in all of my years of call center management. I've never worked in a place where I had not met the majority of my staff and spent almost every day with them, and always had an open door policy where they could walk by my office and stop and talk to me at any time. And those kind of challenges are what we're hoping to navigate this year, getting more of that close connection with the staff that are taking calls, and making sure that we're available to answer questions virtually the same way that we were available to answer questions when we were all in the same office and could hear each other talking to clients on the phone.
Yeah, I was going to say in about one minute or so, can you give us a recent story of how 211 has been a lifeline for a local family in need?
Yeah, one recent story that I've shared with Deanna is that even though we think most calls come in from Lake County residents, there are a lot of times where somebody, a friend or family member, is calling from even other states and are desperate to find help for someone that they love that lives in Lake County. And in a recent example of that is a woman that called into us, and she was calling in to give us an update and thank us for helping her on a previous call where she was talking to us about her elderly brother and his spouse. They were both struggling with mental illness and serious health problems. Her brother has not spoken to her for several months. She's not seen him for years. And his spouse contacts her via text intermittently with alarming messages about that they haven't eaten for days, or that her brother has been hospitalized and injured. Her own husband is going through cancer treatment, so she's unable to travel to check in on her brother in person to see what the situation really is like. And so she called us because she's super concerned about them and their living situation. She told us that after talking to us and getting a list of referrals, unfortunately, that her brother and his spouse were unwilling to reach out to the resources that we had provided. This is always disappointing when we hear that referrals that we've provided did not result in somebody getting the services we had hoped they would receive. The 211 specialist could hear in this caller's voice that she really needed to talk about her concerns more, and she needed to be encouraged to keep trying new approaches. She just sounded very defeated. She was able to talk to her about the important work that Adult Protective Services does. And the caller expressed to us and said that she was resistant to calling Adult Protective Services because she felt like she was calling the police or law enforcement on her brother and that it would end really badly. Our 211 specialist was able to help her to understand how Adult Protective Services actually works, and that they are able to do wellness checks that are exactly built for this type of a situation. And also talking about the wonderful work that the Department on Aging does in Lake County. So by the end of that 15-minute second call, the caller sounded re-energized. She sounded hopeful about the situation again. She thanked us over and over again for the work of 211 and United Way in Lake County, and for being there for her when she could not be there in person. And she did tell us that she would call us back with an update and let us know what was happening with the situation. And we love being able to be here as a resource where people can reach out to us again if they need to. I will be checking to see if she calls us again, and making sure that she's okay.
That is a tremendous story, Kelly. Thank you for sharing that. I mean, that, you know, like it crosses county lines and state lines, the impact of 211. So thank you for all you do. Hopefully, you know, you'll be back in person with the staff there and meet some of them face to face. But what you do essentially is somewhat the backbone of 211 and having it operate. And we appreciate all that you do to help 211 and work the magic that is 211. So thank you for your answer, and thank you for your story. Ms. Lockhart-White, ma'am, coming to you, ma'am. Ms. Lockhart-White, as a longtime agency partner and 211's highest referral partner, 211's highest referral partner is a Community Action Project. The Community Action Partnership serves a critical need, assisting low-income people in the community. What are the needs that you are seeing? How has 211 served as an important resource for the Lake County families that you serve? Please unmute yourself.
Thank you, Mark. I was muted because I had to get over the story. It was touching, and we hear those stories often in our office. I just want to add to what Anna said about the support of 211 in reference to the food. As you know, we were part of the CATCH program, and we received referrals through 211 for those that were quarantined for 14 days in the hotels. So we provided meals for those, as well as we provide meals for the shelters, up to 40,000 hot meals as of the end of March. So thank you to 211 for doing that for us. I think, as everybody has already emphasized, that rental is the number one need that we see, as well as food and shelter. I do want to make sure that the audience know that Community Action has dollars outside of the COVID dollars. So when 211 is referring, we can provide those dollars to residents, Lake County residents, and customers that is not COVID related. We provide through the LAHI, we provide the energy assistance. And this year, the state through the federal has allocated dollars to help with the water through the city. So we will be updating that with 211 because it's critical that we're able to identify, again, our new customers in Lake County. Our old customers know how to find us, but our new customers do not. So it's critical that we're able to identify and continue to address the needs that and the services that 211 is able to identify for us. When last year we served 41,000 plus clients in food, shelter, rental assistance, housing, as well as weatherization to help weatherize homes. When we went into shutdown, we were not able to do the weatherization due to the pandemic. So I am encouraged and I applaud 211 for the things and the partners that have stepped up to help make this a larger, robust process for the clients that we serve. People are hurting, as we've heard the story, and they need a point of entry. And 211 has served that point of entry. And I think we need to rally around and make sure that we do everything we can to serve the community that we so love and want to keep safe.
I very, very well stated, Ms. Starkart-White. And I will echo your sentiment. We need to rally around 211. If anyone is watching, if you are a township official or mayor, any elected official at all, if you aren't heavily marketing 211 in your community, we advise that you do so. Again, no zip code is exempt from any of the needs and services that 211 provides. It is for everyone throughout Lake County, regardless of zip code. So we encourage that. And Ms. Starkart-White, thank you again for all that you do, as well as Cap. They've been around for a very, very long time, impacting the community. And thank you for being here today. I may come back to you in a minute as well, okay? Before I get to you, Mayor Kelly, I have a real quick question. Your story was very moving. So that made me just my own personal, this wasn't a pre-scripted question, but what type of specialized training do the 211 operators receive to be able to tie such a unique situation together, get that person to the resources needed for such a unique situation? So I'm just curious, what type of training goes into the 211 operator?
I think training that would have really helped a lot in this call is mental health first aid training that our staff go through. And also there's crisis training called Safe Talk that our specialists also take. Just really being able to recognize when somebody is needing to talk about crisis related information and to de-escalate when somebody really does start to have a breakdown on a call. So this caller was pretty stressed out, and I think reaching into the techniques that they learned in those two trainings would have been really helpful here.
Fantastic job. They really have to be just as astute and effective and calm as 911 operators, essentially. So great job to you. Mayor McKinney, you with me, sir? All right.
I am.
Okay. All right, Mayor.
Listening to all these wonderful stories.
What's that?
Listening to all these wonderful stories.
Yes, sir. Yes, sir. Now you'll have a chance to share another one of yours. Mayor, what are some of the issues you're seeing in the Zion community and the top needs as reported by 211? Zion is the #2 highest community contacting 211. From your perspective, how do you feel 211 is making an impact in your community? And what do you see as the benefits of promoting this service to the community and beyond?
The benefits, there are too many to list at this point. And you mentioned something, Mark, in your commentary about marketing the service 211 to our residents. That is so crucial. And one of the major things that I've believed in it so much that I've joined the advisory board with 211. And we have talked about the mental health issues, which are important. Rental assistance is the highest calls we get. Electric service payment but just also informing our residents, some who are maybe not as internet savvy, that don't go on the internet and are able to get this information. We've tried to put this information out through our Blackboard, but I also think it's with our police department, our fire department, and our building department, which they contact our residents every day and they leave these brochures with them. So I think as we move forward, I think one of the most crucial things in being able to market the service is like a grassroots door-to-door campaign to make sure those that aren't internet connected, maybe don't have the phone services, are aware that these services that are aware for them. I promote them to each and every citizen that I talk to. And we had an example during the power outage. This was several weeks ago. The disabled resident called me and said that he was running out of power. He lives by himself. He needed his equipment to be able to move around his house. And I had been in contact with ComEd, who was a generous donor to 211, about when the power would be back on in his neighborhood. And I kept in touch with him. And later that evening, I called our police department and said, could you do a wellness check on this address and at this gentleman's address? And they went by and talked to him as his power was running out, and went to Ace Hardware. Ace Hardware donated a generator for him to use until the power came back on. So that kind of story is so crucial and essential that your first responders, the people that work in your different departments, are taking that extra step right now to help our residents.
Yeah, yes, sir. You're exactly right. And we are living in trying times all around, and we must rally around one another and support and uplift one another. But I guess I would say, as Zion being the #2 highest community contacting 211, you know, from you, and as the mayor, you have to deal with housing, food, everything else, all the needs of your community.
Yes.
Would you say that 211 has been able to not only assist the law enforcement and first responder aspects, but as far as the real people living in those homes, trying to put food on the table for their children, make sure they have a roof over their heads? How do you feel 211 has helped those people specifically in your city?
Oh, I think they've helped quite a bit. And that's one of the reasons probably we're getting so many calls, because we're making that service available, know that that service is available. And we work really closely with our township supervisor as well to maybe make sure that we push this information out. But our residents, as I talk to them, they've been very appreciative of it. And we ask them to spread the word to those in need. And I think the other part of this that's essential as we're talking about this, and it's been mentioned, is for those people that you talk to that are afraid to come forward and say that they need help. And this is one of the things that we've been really focused on in terms of letting people know, make that call sooner than later. Don't wait to the last minute as this eviction moratorium might be running out. Call this number. Don't be too proud to get help.
Mayor McKinney, you did an excellent job of segueing me into our next portion. You just don't know how awesome that was. I would like to take our panelists, please feel free to take a breath, take a break, drink some water. At this time, we'll transition just a little bit, and then we'll come back with one final question for each of you. I hope we didn't lose Ms. Lockhart-White, but I would just like to say, we know that sometimes people don't want to reach out, as Mayor McKinney stated, for shame or for guilt or for pride, or they may be too stressed or too tired. They may not even know where to go for help, but we're here to let you know that 211 is a resource here for you. Let's take a look at United Way's new public service advertising campaign, showing how 211 can be the guiding light when times get dark and you don't know where to turn. Please roll the video.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
211, how can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources. Call 211 or visit 211.org. 211. Get connected, get help.
Awesome, awesome. Thank you for that. That is a new advertising campaign for 211 Lake County. Panelists, please turn your cameras back on. A quick shout out to the animators and the artists behind that advertisement. Very, very well done. Very well done indeed. So I'll get you all out of here with one final question for the entire panel. And that question is this. We know the needs of our community continue, and many people are still struggling, or as Ms. Lockhart White said, still hurting as well. We want to know, 211 is a free one-stop shop for help accessing essential resources we all deserve that could ease hardships. How can we all work together, everyone on this panel, everyone on this call, even the ones watching? How can we all work together to encourage people to contact 211 to get connected, get help, and raise awareness of this vital community service? Brenda, start with you.
Yes, I'd like to, I was thinking about two things. Many of the people in this call may work for organizations where their information's on 211. Make sure your information's up to date. If you have a new resource, a new program, keep it fresh, keep it up to date. The better your information is, the more helpful it is to people. And then just talk about it, use it. Think about how to incorporate 211 into your outreach strategies and how you're connecting to communities. I'm very used to thinking about the system, but it's important to remember that crisis that happens could be happening for the first time for an individual today. And knowing that that person will know to call 211 is very important.
Thank you, Brenda. Continue the great work you do at the Lake County CDBG. I'm sure you and I will be talking sometime in the near future. Anna, please.
Happening for the first time for an individual today, and knowing that that person will know to call 211 is very important.
Thank you, Brenda. Continue the great work you do at the Lake County CDBG. I'm sure you and I will be talking sometime in the near future. Anna, please.
Yeah, I think I want to echo what Brenda said. Make sure your information is up to date, and remember that we're all on the same team. You know, we're not competing here. We are collaborating to connect our community members to the resources that they need. So, you know, at the health department, we've got 211 flyers and pamphlets at all of our clinics, in the elevators, on our TVs, because we know that we're partners in this process. And the only way we're going to help folks is by collaborating and by using our partners.
Absolutely. Thank you, Anna, as well, for all you do for the health department. And like you said, this is about collaboration and partnership. 211 is a nonpartisan initiative. So no matter what side of the aisle you're on, we all can benefit from 211. So thank you for that. It's about human services and helping. So thank you, Anna, as well. Kelly, to you.
An important way that we can work better together in the future is to, when we are coming up with new programs and new assistance, new services for the county, as much as possible to always design the intake and eligibility for those things using a person-centered, no wrong door approach as much as you can. Because many times, even in my own agency, when we have new services, we'll set up the process to get into those services in ways that are confusing and ways that the community doesn't really understand. And there's always so many different things in the background, political stuff and everything that make things be built the way that they're built, but always, as much as you can, trying to make a no wrong door person-centered intake process.
Very well stated, Kelly. Thank you again for all you do as well to keep the magic of 211 happening. Mrs. Lockhart White, you have the floor.
Thank you. And I just ditto everything that everyone has already said. And we are continuing to evolve from the state level because we're getting, as all of us are, different requirements that are state and federal mandates. So we will continue to keep our partners updated as well as 211 updated. And as I was hearing, I think we should also post on our website 211 because we have so many calls coming in. And I have to take time to say thank you to my community action staff and board. We have been first responders and our doors never closed, and they have families and their health is important as well. So thank you to the staff at Community Action. But we will also indicate on our website and our marketing material to call 211, especially if they can't get into us. And our phones are just overwhelmed and we just can't take it all. And we don't want people to be on waiting list and all that. So if you go through 211, they will do a screening for you. As Kelly said, they will be that point person and get you to us. So that's critical. And I think that's what I'd like to leave with you, Mark. And thank you all for your support.
Yes, ma'am. Thank you, Ms. Lockhart-White. Thank you very much. Last but not least, Mayor Billy McKinney. How can we all work together and encourage each other to get the message out in the word about the vital resource of 211?
I believe we are. This panel discussion is great. And as a mayor, I am in front of just about every group in this community, whether it's the church group, the Rotary Club, the Kiwanis. I'm on the Lake County Municipal League Board and on the leaders group in Zion. And I make sure that every time I come in contact with these people is to make sure that if their parishioners or other members are in need of help, 211. So I think the dissemination of information, continued communication between us and anyone you reach is so crucial to continuing this great effort.
Fantastic. Thank you, Mayor. And thank you for all that you do as well and your participation in getting the word about 211. This concludes our panel discussion. Thank you. A huge thank you to our amazing panel, Kelly Brown, Mayor Billy McKinney, Brenda O'Connell, Mary Lockhart-White, and Anna Yankelev. I got it. Okay. Thank you for sharing your expertise and insights with us today. And thank you for all you do to strengthen our community. As we wrap up our program, we hope you found the last hour and a half to be informative and that you have learned more about the great work being done in Lake County to improve and save lives, and how 211 is making an even bigger impact every day. A special thank you to the more than 1,500 health and human service agencies connected to 211, serving our community. Just a reminder, please be sure to keep your information for each of your respective services current and up to date. If your information isn't current or up to date and someone calls needing your resource and it is outdated, they cannot receive the help they need. So please make sure your information is current and up to date. If your group needs training on 211 or a refresher on functionality, United Way of Lake County staff is here to help. Please reach out. We need everyone's help to spread the word about 211. Be sure to check the promotional toolkit on the 211lakecounty.org website. Once again, that's 211lakecounty.org website, where you can request printed materials and download materials. Help continue to promote 211 so that everyone who needs to get connected has a way to get resources. Of course, a huge thank you to everyone who has supported 211. Your support built it and has helped us sustain it. It cannot been as successful as it is without you. It takes a village, it takes a community, it takes togetherness. And if one thing the pandemic has taught us, we all need to lean on one another. We don't know what tomorrow may bring for anyone. Your circumstances may be great today, but could change like this. So we must work together to make sure everyone has the resources that they need. We encourage you to join the 211 Club that Chrissy spoke about earlier. And if you're a business or municipality that's interested in supporting 211, your support would be truly valued. Remember, the help is just one call or text away. Finally, on a personal note, I have to thank the wonderful, outstanding Christy Long for her leadership, the chairman of the board, Irene. Thank you, Deanna. Thank you, Julie. Thank you, Lori Neerheim, who was a very humble, works behind the scenes, but does great work. Thank you, Alex. Thank you to everyone on a panel. And thank you all for watching with us for this last hour and a half as we celebrated the second anniversary of 211. We hope you enjoyed the program. Enjoy the rest of your day.